Dr. Andrew Rothschild, physical therapist with the Virginia Center for Spine and Sports Therapy. Hope everybody's having a good week. So, I apologize for not posting a video yesterday. I realized, I was thinking about it, and I really didn't have anything that I could talk about coherently and succinctly and without kind of rambling, even though I do sometimes ramble. And you know, for those of you who either watch it live or watch it later or make time to watch it or happen to watch it on YouTube now, you know, it's you're giving up some of your time to watch this, and I value that, and I respect your time. I don't want to waste it if I don't think I'm able to deliver value with what I have to say. So, as much as I want to try to do this on a daily basis, sometimes there may be, and it may only be a few times a week. And as Bruce Lee said, you know, a goal is not always meant to be something to achieve. It sometimes serves as just something to strive for. So my goal is to do it every day, but there may be weeks where I don't get to it every day because I want to make sure I'm delivering, you know, good information. All right. With that being said, today I want to talk about the concept of less being more. And I was thinking about it yesterday because I had a patient, and this can apply to a lot of you who are dealing with, again, popular topic of persistent pain. So we're not talking about pain after a specific injury. We're talking about pain that's been there for multiple months, even years, where we can say that there's not a significant tissue driver going on now. It's more of a heightened protective response by the nervous system for a variety of reasons. And we've talked about that before, and we'll continue to talk about that. But sometimes those daily stresses that you encounter through work, family, other things going on in your life, amongst the physical things, you're doing that all day long. And so when you come to physical therapy, sometimes doing more is not actually the best thing for you. Sometimes doing less, sometimes calming down the system as opposed to ramping it up is actually what you need. Maybe sometimes lying in a quiet room with some lower light and just breathing and doing some hands-on soft tissue work or gentle joint work to calm down the nervous system is exactly what you need. And then doing some movement, but not necessarily aggressive movement that gets your heart rate up, but just some movement that helps flush fluid out of the muscles and gets some lymph moving and gets a little bit of blood flow and helps sort of maybe reconceptualize movements that have been stiff in the past, that after doing some of the hands-on work and pain is a little bit calmed down and things feel a little bit looser, now you're able to get through certain movements that had been previously stiff or uncomfortable. Sometimes that's all it needs to be. It doesn't need to be lifting a lot of weight and getting the heart rate up and having, you know, some stiffness and some pain as you're trying to force movements into the joints, into the muscles. That doesn't always have to be. Sometimes that's how it has to be, depending on what is needed and what the situation is. But a lot of times, I don't think that is actually what is needed. I think the opposite is needed. So and that's the same thing with doing stuff at home. You know, sometimes the best treatment you can do for yourself is, especially if you're dealing with a lot of stress or a lot of a hectic lifestyle and other things that contribute to contribute to your pain, is calming things down. Instead of doing all these exercises, going for a walk is a great thing. It can be very meditative for lots of people. But just lying in a quiet room for a few minutes, lay down, put your feet up, close your eyes, put on some music, focus on your breathing. It can be as short as 5 to 10 minutes, and that can be help with a significant change in your mental state, your physiological state, and really just calming down the system. Other things that have been shown to be helpful for that is actually walking in nature. You know, putting away the technology, going for a walk in the park, going for a walk in nature, breathing while you're walking, letting the mind just kind of empty and relax. Those kinds of things can be extremely helpful. So if you're finding that you're almost overdoing in physical therapy, or things are getting more sore or more agitated, that's not really the direction that it should be going. So sometimes you and your therapist need to kind of come together and take a step back and reevaluate what the plan is if it's not going in the direction that both of you realize it should be going. All right, and that's my soapbox for today, trying to make an effort in keeping this a little bit shorter and sweeter. Hope everybody has a wonderful day, and I will look forward to talking to you tomorrow. Bye.